So now that we've moved in the last, I don't know, 15 years or so into the outpatient space, that's allowed a number of fellowships to crop up. And for residents, this is really, I don't know a better term for it. It's kind of the sexy new thing to do. They really like the idea of cancer rehab as being this longitudinal care of patients that is so interdisciplinary, both not just with the rehab professionals that you have to communicate with, but the oncology practitioners that you have to communicate with. There's a lot of pain management involved, a lot of procedures involved, a lot of management of complex medical issues involved. So it's really very appealing to the real superpower for the program we have is the fact that we have so many disciplines. So oncologists, no matter how good they are at their job is to kill cancer. So very few of them really understand how to identify, evaluate, and treat all of the issues that go along with cancer, whether it's pain or fatigue or neuromuscular issues, shoulder dysfunction, post-mastectomy syndrome, chemotherapy-induced neuropathy. Their abilities to really deal with them are limited not only just by their knowledge, right? They could do this if they wanted to study, but really by time. Here in America, I don't know how it is in Australia, but you'll have private practice oncologists who are seeing 20, 30, 40 patients a day, which is a tremendous amount of patients. They're using physician extenders like nurse practitioners and physician assistants to get through that volume, but it doesn't leave a whole lot of time to really delve into the issues, the pain and functional issues that are affecting the patient. It ends up being very just knee-jerk, okay, give them some opioids or, send them to so-and-so. So our goal is to be that easy button. So I left to Kessler and Select because Select doesn't just have a relationship with Kessler. It's a big company that all they do is rehab. I joke that their products are function and quality of life. So we have something like 27 hospitals that we either own or jointly manage. So the Kessler hospitals, there's 4 of them: Cleveland Clinic, Baylor, Emory, Cedars-Sinai, UCLA, Penn State Hershey, and a number of other rehab hospitals. But that's only part of the package that Select Medical has. We also have approaching 1,700 therapy facilities in more than 40 states. So we're all over the United States. So that's what the Revital Cancer Rehabilitation Program is. It's a very involved training. We only do it internally. So those, watching this video, we're not in a position yet to train externally. So we train our army of therapists with a very, very comprehensive, multifaceted training program. To date, we have trained over 600 therapists at over 300 locations in 14 of our markets and I believe 10 states. Next year, we have a whole slew more to come in. Ultimately, we will literally have hundreds of sites and, well, we already have hundreds, but many more hundreds and thousands of therapists who have the skills to take care of cancer. And these are therapists who already have, ortho or neuro or lymphedema or pelvic floor skill sets. And then we've layered the cancer on top of it and taught them how it's different, taught them how, one of the interesting things is moving from, Sloan Kettering, this big quaternary cancer center where it's all about the cancer, to moving a company that all we do is rehab, right? So we are the product that we provide. So, that said, all they want to do is support us and make us successful.